Now it's time for the science page. My guest today is Dr. Amrou Hassan, consultant of obstetrics and gynecology. Doctor, welcome. I'd like first to start by asking you about the most common cases you face.
Actually, you face many cases, maybe like infertility, recurrent miscarriage, fibroid, maybe cases of menopause, so many problems. Maybe other things, not problems, maybe happy events like pregnancy and its antenatal care till delivery.
So let's start by the infertility. What's the percentage of infertility in the patients who come to you?
Let's first define infertility. Infertility is failure to conceive after 1 year of continuous marital life without use of contraception. To be more simple, without use of contraception, this means that both couples didn't use any method of contraception. 1 year means 12 months. Both couples are present with each other. Sometimes they may face problems that the husband traveled for 1 month and came another month, but we insist that it should be 1 year, 12 months of continuous marital life. Couples are present with each other. Its percentage is about from 10 to 15% of normal population. But why we stick to 1 year? Because the incidence of infertility should be reported only after 1 year. Incidence of couples to get pregnant after 1 month is only 10%. After 6 months, only 60% of couples will get pregnant. After 1 year, 85% will get pregnant, and 15% will not get pregnant by themselves. These 15% should come to the doctor to counsel them to see if they have any problems or they need any treatment.
So what's usually the main causes behind it?
Causes can be categorized into male factor, which means factors related to husband, female factors, which mean factors related to wife, sometimes called coital factors related to sexual intercourse. Other factors is called unexplained factors, that both couples, male and female, are okay, but we couldn't find the actual cause.
Usually there are a lot of many methods to actually resolve infertility. There are medication, and then there are also certain interventions. So would you talk to us about these different methods of treatment, please?
Before treatment, we can talk about investigations. When couples come to you, at first we insist that pregnancy is like a company. 50% from husband, 50% from wife. Wife give us ovum, husband give us sperm. So in order to know why pregnancy didn't occur, we should make sure that ovum is okay and the sperm is okay. Here in Arab countries, maybe husband gets shy to do semen analysis, but we are insisting that first thing to do is semen analysis. Why? In order to get sure that husband is okay, we only do one investigation, semen analysis. It's like an exam. We check in it the count, the motility, the morphology of the sperms. If they are okay, I say to husband, okay, it's nice, we'll check your wife. If he has a problem, maybe we send him to doctor of andrology, maybe the husband get multivitamins, or I tell you, you have to do an operation like varicocele if he has varicose veins. So then we go to the wife. Causes in wife may be varies. To know why pregnancy didn't occur, we should ask ourselves how pregnancy occur. During sexual intercourse, millions of sperms are deposited in vagina. Then they travel from vagina to cervix, to uterus, to fallopian tube, till they meet the ovum. Then when sperm fertilize the ovum will move back in the fallopian tube till reach their home, which is the uterus. So what can delay pregnancy? Maybe any cause related to this. Maybe fallopian tube, which is the pathway for fertilized ovum, maybe there is blockage in it. Maybe the wife didn't give us an ovum. Maybe she has problems in ovulation, so no ovum come. Maybe she has problems in uterus, which is the home. Sometimes, most of the cases, uterus is like a room or chair in which the baby will sit. If this chair is occupied by another thing, pregnancy can't occur. One of the most important things is called fibroid. One of the important things of fibroid is called submucous fibroid, which is occupying the endometrium, occupying the chair in which the baby will sit on it. Another case is called septate uterus. There is septum in the uterus. Uterus is one room. If inside this room is divided in 2 rooms, the 2 rooms small. Another thing is called bicornate uterus. Uterus is also, I told you, one cavity. If the woman has developmental anomaly, it may be divided into two rooms. In this case, also infertility can occur. Maybe the woman has adhesions inside the uterus. When she do previous cesarean section or previous curettage, there is adhesions inside the uterus. The uterus has two walls, anterior wall and posterior wall. These adhesions will make these walls approximate each other, which will close the cavity. So these are causes related to uterus. Maybe causes related to fallopian tube. Fallopian tube is not only a pathway for fertilized ovum. It contains two types of cells, called ciliated cells and secretory cells. Ciliated cells, which makes the sperm move to ovum and then return back fertilized ovum to the uterus. If there is problems in the cilia, the fertilized ovum can't reach the uterus. Maybe it delays the journey, and so the fertilized ovum, instead of being deposited in uterus, it will be deposited in the fallopian tube, and in this case, she may have an ectopic pregnancy. Another cause can close the fallopian tube, may be adhesion. You can find women who had done previous appendectomy, previous operations, their fallopian tubes are blocked. Another cause may be related to ovulation problems. Sometimes women maybe are so obese. When they are obese, there is a problem in their ovulation, which is so common here in Egypt, something called PCO, polycystic ovarian disease. When you look at this female, you see one who are obese, complaining of hirsutism, which have an ovulatory disorder. When you ask her, is your period regular? She told you that her period is not regular. So many causes may be related to wife or may related to husband.
Well, you've mentioned that the fallopian tube, that pregnancy can occur in it. Wouldn't that be dangerous?
So dangerous. It is called an ectopic pregnancy. Fertilized ovum should sit inside the endometrium, inside the uterus. If it is present outside the uterus, this is called ectopic pregnancy. Most common site to be ectopic is called in fallopian tube. Fallopian tube is so small. It didn't have muscles like uterus. Uterus have a muscle, so uterus can expand, and in which baby grows, while fallopian tube is small, no muscle in it. So when the baby grows inside fallopian tube, it will rupture. And if it rupture, the bleeding and blood will be inside the abdominal cavity of the women. Sometimes we are in casualty department in our hospitals. Women come shocked, they are bleeding inside, and we have to resuscitate them, open their abdomens, and remove the fallopian tube and give them blood. So early diagnosis of ectopic pregnancy is so important, because if we diagnose it late, we will have to do a laparotomy, open the abdomen and remove fallopian tube. But if we diagnose it early, we can do laparoscopy or can give a medical treatment like injection. So diagnosis here is so important. Early diagnosis can save the life and can save the fallopian tube.
Thank you very much.